to our session on healthcare philanthropy in action, stories of gratitude and giving that have given back to the PA. Done. I'd just like to acknowledge the traditional custodians on the land where we gathered, the Turrbal and the Yagara people, and express my regards to elders past, present, and just make acknowledgement of any First Nations people who are here or watching online today. Hey, I'm Damien Top, the CEO of the PA Research Foundation. It's a real honour to talk today and to bring this session to the PA community and to really try and reinforce some of the things that we've been doing and been getting underway over the last few years, and provide some examples through our panelists today. I'm sure you've all had someone who've helped you move, or that neighbour that's got the washing in for you when it's about to rain, or picked the kids up from school when you got stuck, or even just shouted you a drink. And I'm sure you felt really grateful for all of those things when they happened for you. And I'm sure many of you have had a loved one or yourself been in hospital. And I know that when people spend time in hospital and they get great care, then they also, want to express their gratitude. I know from some of my relatives who have spent time in this hospital that they're very grateful from the amazing care that they get in almost every department across the board here at the PA. Almost all of our donors to the PA Research Foundation that make things happen in the way of research, patient support, and equipment and staff training that we invest in every single year. Almost every donor that comes to us is someone who is expressing the gratitude for either themselves or a loved one who has been in hospital. Whether it's a big gift that helped us change the way the Gamma knife was provided here, but there was a $300,000 bequest to spinal injuries, or whether it was Ray who used to come in and make a $25 donation every single time he came for an appointment because it was a really special part of his experience of coming into the hospital. We know just how grateful people are and how much they want to give back. Unfortunately, those donors of ours only represent a really small number of people that come into the hospital, and only a small number who want to give back. And the reason is pretty simple, because for all of the wonderful care that's provided by our staff at the hospital, we haven't done a good job as the foundation to help our clinicians and our other associated staff at the hospital be able to accept and respond to that gratitude. Quite often, the common response when a patient says, "How can I say thank you?" is, "I was just doing my job, don't worry about it." And when you dismiss people who want to express the gratitude, doesn't leave them with a very good feeling. So we've started to put in a really active program where we have some of our staff going around teaching some of our clinicians and our other hospital staff just how important it is. And there's a lot of studies and a lot of research that is actually being done all around the world, just how important it is to enable patients and their families to say thank you as part of their healthcare journey. And we know firsthand from the donors that we speak to, and it's my great privilege to welcome 4 people to the stage here who are going to share some of their experiences and how just being able to being allowed or enabling patients and their families to express their gratitude and giving them the space to do it in the way they wanted has really made a difference. So let me introduce, in no particular order, Philippa Parks, sitting in the middle. So Pip is one of our grateful donors, and we'll share her story in a minute. Dr. Matthew Tunbridge, who's a nephrologist in renal medicine. Brad Cummins, who Brad is the Assistant Nursing Director at HLCC. And from our foundation team, Caroline Shawallow, who is our Senior Philanthropy Manager for the foundation. Now, because you're the most important person on the chair, Pip, I'm going to start with you. There's a microphone just there. Thank you very much, Matt. Can I just ask you, why did you decide, well, for starters, tell us who you are and how you fit into the puzzle.
Hello to everyone here and listening online. My name is Pip Parks. The reason for being here is my late husband, Stephen Parks. Stephen had a very, very long journey of over 30 years with chronic renal failure from IgA nephropathy. He was first treated here with the legend and wonderful, extraordinary Professor Carmel Hawley, and she cared for him to the very end. So we've had a very long association with the PA, multiple visits here for various health episodes, including 2 transplants, various other complications and sequelae that had to be dealt with and were dealt with here at the PA. And also in the latter part of Steve's journey, we undertook the home hemodialysis. So shout out to anyone from Burke Street who might be listening. And so we had a very, very strong connection with the PA through his journey. We both have had a medical background. My husband was an anaesthetist, and I was an ex-medico, so we also both were medical students here. And so our association with the PA is fairly extensive and quite long. Stephen passed away a couple of years ago after a very long and tortuous journey, and it was something that we had discussed about what could we do. We wanted to do something, and so it was all about how can he be remembered, but how can we also benefit and perhaps help other patients like Stephen and their families that are also on that health journey, and hopefully make a difference for them. So that was where I came to reach out through Professor Hawley to the PA Foundation, and just what we might be able to do together that could make a difference.
And what was your conversation with Carmel?
Giving the donation, the PA Foundation was an obvious starting point and always had been, because we understood very much so the benefit of research. And of course, Carmel, anyone who knows Carmel will know her very long extensive association with research. And so it was an easy first point of contact. Carmel, how am I going to do this? So we just went from there, had a few conversations about various aspects that were potentially an area we could look at that were relevant to Stephen and his journey. And then with Carmel's knowledge of what was going on in research at present, where best we could perhaps go and get bang for buck, basically.
Okay. Do you remember what the project was that
it was funded? Yes, we had tossed up a few ideas, but for Stephen, there were 2 particular areas that had a profound impact on his health journey and really were quite extraordinary. One was with respect to vascular complications, and the other was with respect to his skin journey. As a result, immunosuppression for the transplants. and that became a huge part of his medical his health journey, particularly in the last few years. So they were the two areas that I was particularly interested in. And in the end, it was a pretty easy decision to go down the skin cancer route, but in particular, skin cancer in organ transplant, solid organ transplant patients.
And there was a project that had been started by Kirash and the team in dermatology not too long before that would have been part of your journey. And so yeah, I'm really pleased to say the foundation's got that sitting with James and Kirash, and they've been well underway with their research, and we'll be eager to share with you the results of that. How important was it? Well, how did you feel when you were making that gift, and how important is that for you?
It was very important. At one point in Stephen's journey, basically everything had been ruled out. All the usual options were gone, and we had to essentially have a go at some immune therapy. And, you know, please remember I'm going back a few years here. It was very much an unknown. It was a best guess. And when we asked our oncologist, what kind of research, what kind of evidence can you show us as to what are our chances here, what are the effects? In essence, there was one report, and it was, despite the fact that it was multinational, it had a patient group of under 100, and there was no one like Stephen. There were no transplants, there was no dialysis. So it really was a hope and a prayer. So that was something we found quite difficult. And, you know, so the idea of being able to give some money towards a project that really looked at a patient group that was Stephen, was relevant to Steve, and hope that this was a little step that hopefully will lead to another, to another, to another, and finally there's actually a leap, and some patient and that person's family coming along in the years to come, when they ask that question, what evidence can you give us to say that this treatment is going to help? They're going to be saying, here you are. And it's going to be a research that is directly relevant to that patient group, someone like Stephen. And it feels, you know we're probably not going to benefit. Hopefully my family, myself and the children are going to be okay, but the idea that hopefully we have made a little bit of a difference, and the idea that, you know, Stephen hopefully would be going, yeah, well done, Pip, good choice, and congratulating the team for making that difference. It's very important, and it was a very good day to be able to finally, okay, we're here, here's the money.
Yeah, very nice. I'm going to turn to you now, Matt. If you wanted to start and introduce yourself and tell you what you do in your day job.
Sure. So my name's Matt Tunbridge. I'm a nephrologist. I've actually taken over the vacant position left by Professor Hawley, who's just retired and left extremely large shoes to fill. And I have a background of completing my PhD, soon to be submitted, in vaccines and improving the efficacy of vaccines, particularly in patients who are immunosuppressed. Which was funded by philanthropic endeavours, both in my PhD scholarship and the major projects that were undertaken as part of that. Having completed a lot of my training at the PA, I've spent the last couple of years at Duke University in the USA and down at the Royal Adelaide Hospital in South Australia as well.
Very good. So as almost the new kid on the block, and can you tell us, how often do you have families or patients saying, I'm really grateful for the care? How do I say thank you?
I particularly in transplantation medicine, as part of the overall spectrum of renal medicine, we have a lot of extremely grateful patients. Dialysis as a treatment for end-stage kidney disease is something that is an arduous journey and a very significant life impost for our patients, and they are almost to a person extremely grateful for the care they receive when they receive a kidney transplant. And as part of that, I would say that the registrars are probably the people who hear the most often, the mid-level doctors, because they're also the people who are most often in contact with the patients day to day, seeing them in clinic on a daily or twice weekly basis, and receive a lot of thanks, which is sometimes difficult to direct, especially at a junior staff level. But we receive a number of very kind cards and a certain number of bequests as well for out of gratitude for the work that's done.
Yeah. So you probably can elaborate on this a bit more, and you part answered it. How do you respond?
I have become more able to respond over time. As a junior doctor, I did not know, and I would usually respond with, "I'm just doing my job. It's absolutely fine. Don't worry about it." In more recent years, seeing as I've been lucky enough to be the recipient of money donated by people for the specific research that I have done, as part of either larger bequests or as part of specific bequests like the one you described, Pip, I have become more willing to engage patients and discuss with them about whether they would want to take that any further, if they would like to demonstrate gratitude, and some of the ways that that can be done in a personal and yet not personal for me manner, so that we can direct the desire to give monetary bequests towards a better purpose, like the Research Foundation or specific research-based bequests being probably one of the best options for that.
Okay. We will get more to some of those solutions later on as we chat. Now we're going to move to introduce a really special person. But before we get to that person, I'll get Brad to tell you about what he does at the hospital.
Good afternoon, everyone. My name is Brad Cummins. I'm the Assistant Nursing Director in Heart, Lung and Critical Care. My history here is about 21, maybe 22 years as in the intensive care, and primarily 12 or 14 years as the nurse unit manager.
Very good. We're going to spend some time now introducing you to this guy, to Gavin Simpson. Gavin is no longer with us anymore, but he had a very interesting accident that brought him to ICU, which I'm sure Brad can elaborate on a little more. And over time, really fell so much in love with the care that he was getting at ICU that he could not go out of his way quick enough to express his gratitude and show support, and ended up that he, after he passed away, left a perpetual gift that goes on now to provide some really interesting things in the ICU department. So tell us a bit about Gavin.
Yeah, it's a great honour to, I suppose, represent Gavin today. He's a true bushie at heart, and in 2013 he was riding his motorbike, mustering some, I think, cattle at the time.
Helping out a friend.
Yeah, helping out a friend on a farm, and got collected by a kangaroo, and was airlifted to PA, and he was in a pretty bad way. He spent about 20 days in the ICU, including having ventilation, a lot of medical support, a tracheostomy, and suffered a lot of the consequences of being in intensive care for that period of time, around delirium, agitation. And a lot of our patients don't commonly remember ICU, and I don't know how much Gavin remembered, but I think things came back to him slowly over many years. And so, yeah, Gavin was a very astute businessman, and it turned out very wealthy, and very supportive of the care that he received in PA.
Yeah. So when Gavin first wanted to make a gift to the ICU, what was your and the unit's reaction? How did you respond?
Kind of like we've discussed here. At first, it's just Pretty much, it's our job, and we want to provide really exceptional care to the patients within.
Can I just interrupt
Yeah.
there? Do you understand how hollow that can be for the person that hears it?
Yeah, I think
Yeah.
I don't think we understand that as much
Yeah.
at the bedside, and I think we really just want to provide the best for them. We are obviously it's a paid job, and we do it for love. Often in intensive care, it takes a lot of energy, both emotional and physical energy, to manage patients. Gav's not the smallest man as well, so it took a lot of physical effort to manage him as well. But I think. As time went on, Gavin's threats of more donations really meant that it was starting to become a little bit scary from my perspective as the manager. And whilst I was managing, I don't know, 40 million a budget in the intensive care, the threat of donating hundreds of thousands of dollars to ICU became, I suppose, a little bit daunting from my perspective. Small donations are lovely, and really we can provide wellbeing and small supports to our staff. Gavin's money means a lot more than that, and really is probably going to last us indefinitely.
Yeah. So, what part did the foundation play in bringing Gavin's gift to fruition and giving some rigor around?
It was vital. The threats of paying for the Christmas party when we didn't know was nothing compared to when he said, "Oh, I'm going to give you $200,000 straight up," and then bequeath him the will, a lot more money. We really were out of our depth. Managing money that's donated often comes with a lot of responsibility, tracking, paperwork, and I think the PA Foundation was vital in creating that connection. And ultimately, when Gavin passed away in March of 2020, connecting us with a philanthropic group to really make this, as I said, last indefinitely. It is a really great honour and responsibility for the nursing manager to take on to manage Gavin's support, and I think it's been vital. I think, and I don't see Sandra in the crowd, who may be online, but she certainly keeps me in line as well. We obviously have a really stringent guideline around managing his educational bursary fund, and so we've got some real good rigor around that, and that's the PA Foundation really supported us in creating that as well.
So, what do you do with the money besides hand out cash?
So, again, as I say, Gavin's really astute businessman, and so he had really clear ideas, which is really helpful in managing this. And so our fund, it supports the staff primarily in education and training, upskilling the intensive care staff to be better clinicians. And he said the clinical support he got was amazing, but really wanted to continue that. We know, there's a lot of challenges around workforce, and so perpetuating that. So staff are encouraged and actually remunerated or rewarded in doing postgraduate qualifications or master's studies. It also supports the staff in the unit, and that's everyone, admin through to the clinicians in staff wellbeing. The odd day where it's a really difficult day, Gavin really supported us in, getting some pizzas. And so it's not locked down, but is very supportive to the team. And that was what he was really passionate about. We talked about, doing a little bit of capital expansion and things, and he was like, no, that's the expectation of the organisation. He wanted to provide for the staff specifically, and to improve their feelings and work.
Yeah. Part of what the foundation's role is in helping manage those expectations from the donor and the donor's family, and also the team, because it's really easy for a patient who's been in hospital to sit there and see the same chair sitting there with a rippet and leave the hospital, and they come back and they call up, and it happens very, very often. They call the hospital, who put them through to us, and they say, "I've bought a chair for that bed in the ward where I was. Can I bring it round?" And as lovely as that is, there's only so many chairs you need, so many pictures on the wall, so many paintings, and other things. And for us to be able to be that body that can have those conversations with the patients and their families to say, hey, it's great, it's a really good thought, but what they actually need is X, Y, and Z, so that we can make sure that their gift is the gratitude's reciprocated, but we also get the right thing for the hospital, which creates closes the circle. And Gavin's was one of those classic ones where he was just so grateful that, if someone unwittingly had have walked past and said, what we really need is a sauna in the staff cafeteria for us, Gavin would have had it there the next day.
He often he'd call me usually once a month on a Friday. It was a wonderful call to get. It sort of broke up the day. And he goes, I've just been talking to Damien. And then you'd think, oh God, what is he going to tell me now? And so, and always, and I was reflecting over some of his emails actually earlier this week, and just he was always closing the loop around, what else can I provide? Oh, can I do anything? Can I buy something for? And so it's really, I think having that link with PA Foundation was really vital. And I suppose it reduced the workload of the clinicians as well. It was very easy to link in. And we do that still today in recommending the conversations and discussions that happen with the team.
So Gavin he wasn't very mobile after he'd been at the PA, and I'm pretty sure this was his only visit post thing. So I remember I actually went and picked him up from the airport, and it was the longest, slowest walk from the gate to the car I've ever had in my life. But we chatted the whole way, and he got that, and it was a really great time for him to come to meet some of the executive and really close the loop and be able to experience firsthand what he'd done for so long. And that's really sowed the seeds, from what I understand, of him establishing a fairly sizable perpetual gift to us and another charity that helped him out. Would that be correct?
Yeah, I think he was a dog lover as well. So not only did he help RFDS, I think he's helped another not-for-profit organisation in Sydney as well. But yeah, certainly that was a wonderful day.
Yeah.
And the staff know who Gavin Simpson is. We the bursary goes out twice a year, and some staff ask that question, and we're able to tell a really great story around that, and that's really really special.
Yeah. I'm going to throw to and introduce, or ask Carolyn to introduce herself now. If you want to grab the microphone.
Hello everyone. My name is Carolyn. I'm the Senior Philanthropy Manager here at PA Research Foundation. I've been working here at the hospital for nearly 7 years, and my role is to help donors, major donors in particular, and bequesters to express their gratitude and to take them on that journey and show them how that gratitude can benefit the hospital.
Yeah, great. So I did allude when we were starting that the foundation's really investing some time in getting around to the hospital departments to actually build those relationships and help educate clinicians on this is how you can respond when people say, hey, I'd really like to express my gratitude. I want to say thanks. What can I do? So that we can catch people before they actually go through the experience of running into a Gavin Simpson or being the recipient of a philanthropic grant. So we can actually keep those stories of gratitude going, but also respond to the patients in the way that they'd expect to be when they say thank you and not get dismissed. So Carolyn, what are we doing in that space, and what's some of the things that the hospital staff can do to help us?
I think there's a couple of important points for staff at the hospital. If your patient says, how can I thank you for the amazing care you've given me? The first and the most important point is to accept that gratitude. Words to the effect of, thank you very much, you've made my day, are really important, because for a patient to express their gratitude, it's actually part of the healing process for them, and it makes them feel good to acknowledge you as an amazing and wonderful human being that's showed empathy and care to them. It's very, very important for them. And the second thing too is if that patient wishes to show their gratitude, then asking their permission to pass on their details to the gratitude team, which is us at the PA Research Foundation, and then we, on your behalf, can then follow up with that patient and find out what gratitude means for them. In some cases, it might mean a letter to the physician and the nurses to thank them. In some cases, it might mean some coffee vouchers or flowers. Other cases, it may be a gift or a major gift, and sometimes it can be a legacy gift. But whatever that means to that patient, we can investigate that on behalf of you, and we can follow up with that person and make sure that we close the loop in their care journey and enable them to actually show that.
Yeah, and look, this is a really great way on how we can cover some of those gaps between what's provided to patients as clinical care, and also what we can do to extend the service, to extend more training with staff, to provide research so that people can be better clinicians, or also to get equipment. Over the last few years, as we've been being known for being the conduit and the contact point, we've been able to secure gifts for a number of pieces of equipment as well that have just changed the way that people deliver service within the hospital. Now, back to you, Pip. Now, I should also tell people that Pip has been within the health community for her working life also. So you probably can share some insights, not just as a donor, Pip, but you've had a loved one in hospital. You've been in the sector. What are some of the things that we could do better?
Certainly, I've been in both camps, and both wanted to say thank you to staff in different wards where it's been quite extraordinary, but also, 2 a.m. being very grateful that somebody's donated not just one box of chocolates, but, the box of chocolates for night duty as well. So I think, as you said, not just saying it's my job, but to acknowledge that thank you and being willing to take a next step with them, whether it's simply may I pass on your name and contact, or if there's, I don't know if the wards had a little card with PA Foundation details on it. Here you are, here's a website that you can reach out to, and being able to have an idea about what your ward needs, and anything from the simplest thing like a decent coffee machine in the staff room to more pressure support cushions, which, geez, they cost enough. So I think kind of having that wish list in each ward, in each group, that doesn't have to be some extraordinarily expensive piece of equipment, but can be something that will make a difference to the staff and make their day a little bit easier, but can also, maybe it's something that will make it a little bit easier for the patients. So being able to help someone express their gratitude in a very practical way, whether that's very small gift, $20 donation to the foundation, or whether it's being able to contribute something a little bit more substantial, but being able to have those kind of ideas already there that can be quickly conveyed to someone like Carolyn, I think that's very, very important, and engaging with people and not quickly sort of not dismissing their expression of interest in actually doing something tangible to help.
Yeah, that is a really good point. It's one of the things over my time here is every time we often will get a gift and say, look, we really want this to go towards something in Biro or in nephrology, and we call the lead of whatever area it is, and so we've got this gift of X. what can we help support you with? And sometimes we'll get no response back for some time. Sometimes we'll get back, well, we need some tables that go up and down, and it'll be like, well, that's great, but there's probably another $50,000 there that we could do something really important. So thinking ahead and actually knowing what are those gaps and what are those things that people could support with, is something that we can take on board as part of our education too.
I hope this doesn't come across as being offensive or trivialising the discussion, but it's kind of like an old-fashioned wedding gift registry.
Yeah.
The idea of having different things that cater for someone who wants to give you something that you like and you'll use, but they can't afford much, right up to, the doting, wealthy uncle that can buy you the incredibly expensive woolen, blanket. Whatever, having all those different little things and keeping that kind of wish list sort of up to date can make a difference, because then Carolyn can actually propose something very tangible to someone that she's having a conversation with who wants to give something.
Yeah.
And they need to feel that they're doing something that's going to make a difference, maybe not tomorrow, but next month or their next visit. And then there'll be those that, are happy or more orientated towards a research angle, which is more esoteric. It's obviously there's a lag period before you may or may not see an outcome for your donation. So, and being able to cater for those different wishes of patients and their family, I think, caps on and create the wish list.
Yeah, great. Matt, from your perspective, how do we get the next bursary to the next Matt Tunbridge?
I think probably from a sort of senior medicine point of view, it would be helpful for us to have a talk with junior staff, as they're often the point of first contact, and maybe including this in some of our education, because a lot of junior people are very highly motivated to pursue new things and open to new ideas, new needs that are brought up to them by patients that they may be able to then turn into something like a training project or something that can even develop into a bigger research interest like a PhD. And perhaps at a systems level, if we're able to improve that education process, we may be able to more effectively allow philanthropy to grow.
Great. Over to you, Brad. How could we do better? And collectively, how could we do better?
I think you do a pretty good job. I think weeks like PA Giving Week, I think, is a really great incentive. It incentivizes not only for the individual staff, but for the teams. And we've had some great work in, say, heart recovery service, where we've been able to get some equipment. I think, like Pip says, I think having some easy to access cards or posters in each department would assist in maybe, I think, bridging between the awkwardness of being praised and thanked for the care that you've provided, because a lot of people do it out of passion and are looking for no benefit, but it does benefit our staff in the intensive care, and it has benefited across the hospital as well. And so I think it's probably a very untapped. But I think that connection is there. I do think it is there, and the team are great. They're very accessible and available for the leaders. And so I think we do a pretty good job.
Carolyn, you and Ellen have been working directly with radiation oncology and heart-lung critical care. What are some of the comments and some of the things, some of the barriers that you've picked up so far?
Some of the things that have been mentioned are in the process of being completed. We are looking to install some visual promotions around gratitude with QR links that takes people through to areas where they can actually show their gratitude. We are becoming part of monthly meetings in departments where we can actually show them examples of what gratitude has been able to achieve for the hospital and also for that particular patient. Also, the other thing to remember too is quite often someone will give a gift, but they will continue to give. And the reason they do that is because you're all wonderful caregivers, and we report back to them on a regular basis and show them what the difference is continuing to make as we move forward from their donations and others who donate like them. So I think that's really important as well.
Yeah, I think that's why the foundation's here and why we exist, is so that that clinicians and the hospital staff can make that connection and get on with their job and keep on providing wonderful care, and we can talk about that relationship with the donor as a donor and make sure we're closing that loop all the time. We've got lots of time for questions from the floor. If anyone would like to ask something of our panel. Thanks, Michael.
Thank you for all those insights. That was really worthwhile. You've spoken mostly about the situation where you have the opportunity to speak to the donor about what should be done with that money. Can I give you a different scenario? Say the foundation has been given a sizable bequest, maybe a legacy request, but they haven't actually said what they want to be done with it. They might say, oh, I want this to go to something to do with cancer. What do you do then? How do you decide where the money goes to and what it's used for?
I'm getting PTSD just thinking about the number of times we have gifts that come to us that is for, we want this to go to spinal, for example, and we start the conversation and unfortunately, one of the things that happens in health is that people change and leaders change, and so the consistency is really hard to keep those conversations going. So sometimes we have to determine it. If there's absolutely no restrictions on the gift, we'll often make it a specific research grant. So we will say that that's our number one remit is research. So we will say there's an extra X dollars for a research grant in that space because that's easy for us. But the first port of call is I go out and I talk to all the directors of the departments and the executive directors of the hospitals monthly and quarterly. And now I actually sit down with them and say, transparently, we've got this money. Is there any immediate need now? And if there's not, then we look at our research.
I imagine there are discussions with the family, of course.
Yeah, I mean, if they're a deceased person with no family, but yeah, we often, Carolyn spends most of her time speaking to our donors that do that very thing. And it's that conversation around, I know you want that to go towards Wi-Fi at level 4 where you were sitting all day, every day, but there's already Wi-Fi installed there. What else can we do with that? Yes.
Well, can I keep asking?
Yeah, go on, go for it.
What are the reporting responsibilities of the people who receive a bequest?
As in, what's the responsibility of the people, the foundation, or the people, or the end recipient, the hospital department, or the researcher?
I'm thinking of the donor, not reporting back to the donor family, for example. Yep. Are there any formal commitments that the recipient has to?
It depends on whether it's coming from if it's coming from a charitable trust or a philanthropic organisation like Gavin Simpson's. The Gavin Simpson Fund is managed by a philanthropy manager that we have to report back to, and right. Sandra's often rattling Brad to say what's happened so far so we can get back to them. And that is actually great because it creates these unique opportunities for us to go back and even though they're managing the Gavin Simpson Fund, they're also managing hundreds of other funds that we can say, well, this thing's happening as well, and we can maximize our relationship. So it depends on whether it's that or whether it's coming directly, but Carolyn's probably best to answer that.
Bequests can take the form of quite a few different things. It could be that a perpetual trust has been set up by the bequester that is managed by a company like Perpetual Trustees, for example, and they may have nominated people that get the benefits of that fund every year, and perhaps we are the recipients of some of those. And it depends on the trustees as to the level of information that they require. So whatever they require, we will give them. Some people like to have a report as to where the funds have gone. Some people are happy to just have a receipt and a letter of thanks. Individual bequesters, where possible, we will involve family members or even the solicitors who we have dealt with respect to the bequest. Previously, when given a bequest, and for example, if we've allocated that to a research award, we have invited members of the family and also the lawyer/solicitor who's been responsible for that to come along and see the bequest being presented and to be part of that process as well. So there's lots of different ways that they're given to us. Sometimes we get a bequest and there are no family members and there are no need for anything except a receipt. So where possible, we involve people to the best of our ability.
No one else. Okay.
But it's online.
Thank you. Thank you. Thanks, everyone. I've got a question for the panel, and touching on that last question. So obviously, we would like. So I'm Luke. I'm from the foundation. We would love the hospital staff to be helping us facilitate that thank you between patients, grateful patients. Is there anything as clinicians or Pip, as someone who's been on all sides of the equation, is there anything you would like us as the charity to know to help facilitate and reward that trust that the hospital shows in us?
I think the ability to make life easy for the clinicians, for the admin staff, receiving those requests. So to my mind, the idea of having something like a card that you can hand over, I think is useful. I've certainly seen there's a lot of posters up as I walked in today, and the QR link and things like that. That's great, but not everyone's quite tech savvy. And I think being handed something, put something in their hands that gives them a phone number, a website address, an email address, I think that's useful. And being able to take advantage right there and then of that expression of, we want to do something to say thank you, how can we help? Life gets busy, and if it's weeks down the track before someone is able to reach out to them, or that little post-it note, Mrs. Smith wants to say thank you, is found, then an opportunity may very well be lost. So I think being able to take advantage very promptly and saying, that's wonderful, thank you, I'm doing my job, but I'm grateful that you've said thank you for us, and I'm really pleased that you'd like to help us out in some way. Here's an immediate point of contact. I think that would be a really useful thing to be able to hand over. Okay. And that can be sitting in the outpatient clinic reception. It can be sitting with the ward receptionist. It can, even in the night duty, somebody can grab that from the desk and here you are. And it's there. And I think being able to take advantage of that initial expression as quickly as you possibly can is a good thing for everybody.
Yeah, great. Cool. Any other questions from the audience? No?
What about, when you go to a shop and you see a little thing where you can put coins in? You could do the same sort of thing in the outpatient area while people are waiting to see their doctor.
Sure. The only problem with that is that not too many people carry cash anymore.
No, I didn't mean cash. I mean,
But yes,
to
you're right.
hold the
I mean,
cards,
just
yeah.
having something.
Would you like to express
yeah.
your gratitude?
Yeah.
They're thinking about it. Oh, I might grab one of those.
Yeah. And being able, and on those pads, being able to give people an option of whether it's just something as small as $5
Yep.
to, feel free, donate 1,000 if you'd like, whatever.
We might throw to each of our panel members for a final comment.
I'd just say I'm extremely grateful to the people who funded the research that I've done over the last 5 or 6 years. I've been recipient of some very generous research scholarships and grants, and it's a very important thing that continues to fund excellent work that has really good outcomes for patients. And I think anything that we can do to continue that is really worthwhile because it makes a genuine difference.
Pip, anything further from you?
I guess, first of all, just like to say thank you. I mean, I don't know if anyone in this room was ever involved in my husband's care. God knows there's been enough that have been over the years, both here at PA and at the Wes and elsewhere. So thank you, and just thank you for all of the work you do, from the tea lady to the ward receptionist to all of the nursing staff, the physiotherapists, the dietitians, the doctors, and obviously the legends like Professor Carmel Hawley. Thank you to all of you. But in terms of going forward today, please do have a thought about the things that might make a difference to your work, to your patients that you care for. Start setting up those wish lists. And the next time somebody does say, hey, I'd like to help, be ready to engage in that conversation. I know you won't have a lot of time, but give it a chance. Do say something, because you might make a really big difference in the long run to both your own work, your patients, and perhaps in the long run with research. And just remember that each and every single one of you, whether you know it or not, you individually may have a huge, profound impact on someone. They go away and they remember that particular nurse who made such a difference to their loved one or to them. So yeah, just continue on and stay strong, and thank you again for all of your work. And yeah, that's about it.
Thanks, Pip. Carolyn?
You're all amazing, and you all show such wonderful care towards the patients you treat, and your patients want to thank you. And we are a resource for you. We can do that for you. We can help you with that, and we can investigate what thank you looks like. So please think of us when your patients wish to say thank you to you, and we can help you with that.
Brad, words from you, words from Gavin?
Yeah, well, I think mine's probably twofold. It's thank you to the PA Foundation for being there. I think, particularly with Gavin, without the dedicated, focused team, I think there was probably a great loss to the hospital and to the staff and wellbeing. Particularly, we've suffered through COVID and all those sorts of challenges, and Gav sort of propped us up, even though he passed away, 5.5 years ago. And I think, know that having a dedicated PA foundation team means that these go on. And I think, Gavin, as I said earlier, Gavin's fund is going to last years and years and years in the intensive care and through our expansion. And I think, that's a great legacy. But the team are fantastic. I've probably got outstanding emails to Sandra, and I'm glad she's not here because she'd probably kill me. But I think it's so good having a dedicated, focused team that can support the clinicians, and I feel supported. I'm being in a lucky spot to have an opportunity, but I think there's probably a few tweaks we can do on a clinician's end as well.
Yeah, great. My final word is, as was alluded to, is next week is our Giving Day. So keep an eye out. We really focused our Giving Day in. I know there seems to be one everywhere, but for the PA and for all the other hospitals that we now support in Metro South, Giving Day is for us about encouraging the staff in every department to reach out to their friends, their family, the patients, and say, hey, this is a really wonderful place that I live. And if you donate today, the foundation is going to match our gift. So please get involved. And if you haven't, contact the foundation. And thank you so much to our panelists. Big hand for them. Thank you all very much.